After a thorough examination and an X-ray, and on some occasions possibly even a cone beam CT scan, the tooth is numbed using a local anesthetic solution. This is going to make treatment more comfortable for the patient, and supplementary anesthesia may be required for the gums around the tooth here. Once the tooth has been fully numbed, a rubber sheet or vinyl sheet is usually placed over the tooth. This is to make sure that the tooth is as sterile as possible, as saliva is full of bacteria and we do not want root canals to be infected where possible. This is also, it makes it much easier for the patient to tolerate treatment. There will be no water in the back of his throat, and we can actually make treatment easier for the dentist as well and more efficient. Once this has been placed, a small hole is made at the top surface of the tooth. This is to allow access to the pulp so that the inside of the root canal system can then be thoroughly cleaned out. This is washed out with disinfectant solutions, and very fine and delicate instruments using hand and rotary are used to clean and shape the inside of the root canal. After further disinfectant, the root canals are then sealed, either with a rubber-based material or a lot of more modern materials that are available that the dentist may find suitable at that time.